So a question I'm often asked is, how do I know if the chest pain that I'm experiencing is coming from my heart or from some other source? And the answer to that question is actually a lot more challenging than you would expect, because it all depends on context. So before I move any further, I want to preface this by stating that everything that I'm discussing is not official medical advice, and rather, if you have chest pain or other symptoms that are bothersome to you, do seek consultation with a physician. But in brief, chest pain that is not coming from the heart is often sharp or has a stabbing quality. It's fleeting, meaning it lasts a few seconds at a time, and it's often random. It isn't really associated with any specific activity. On the other hand, chest pain that's coming from the heart often has a dull quality. It might feel like a squeezing or tightening sensation. It often radiates into the arm or into the neck, and it can be associated with symptoms like nausea and shortness of breath. Now, the whole situation changes if, in fact, you have risk factors. So if you have a family history of heart disease, you have a personal history of cardiac disease, you have high blood pressure, high cholesterol, things like this, then even atypical symptoms in these instances might, in fact, represent true cardiac pathology. So the bottom line is that if, in fact, you have symptoms that are severe, they're persistent, they're bothersome to you, then in those instances, you still want to get checked out by a physician or a cardiologist. But it's helpful to have this guideline so you have an idea of what you're dealing with the next time you experience chest pain.